Thank you. I rise today, Madam Speaker, to share with you and my colleagues here in the House stories of real Americans and how health care reform affects us, affects them. For it affects every walk of American life. And many of my constituents have shared their stories with me and asked that I share those stories with my colleagues and with the American public. And perhaps my colleagues and the public might see in this story something of themselves. I want to share a story, not a happy one, but a story that one of my constituents named Kelye Lots Andrews shared with me. Kelly's father worked hard all of his life. He succeeded to a certain extent. He lived the American dream, was very successful in the broadcasting field, and Kelly says at one point her parents combined were worth just over $1 million. They had a successful career. They saved up. They had a house. They made payments on. They built equity. They lived the American dream. They were anticipating a comfortable retirement. In their early 60s, as they were putting their affairs in order and preparing for what they thought would be a prosperous and long retirement, they decided to change health insurance companies. During the qualifications testing for the new insurance, Kelly's mother's liver enzymes were slightly off. So a couple weeks later, they asked her to redo the blood tests. Kelly's parents were moving to a condo on the beach, so when they got settled, they found a doctor and they got the required test done. Unfortunately, the doctor found a tumor on one of Kelly's mom's ovaries. The new insurance company then refused her coverage based on this pre-existing condition, the scarlet letter of health care, even though she had continued her coverage just before the diagnosis. So without insurance and without the hopes or ability of acquiring any, Kelly had to watch as her parents got rid of all their assets, all their savings, and all their retirement funds. All became liquidated as their mother fought to stay alive and pay those hospital bills as uninsured Americans. Kelly's mother lost the fight. After beating the odds by 5 months, more than the doctors predicted, she passed away in 2004. Kelly's father, who's now 76, now, despite a successful career and doing the right thing and saving up, has no retirement funds, no savings, no house, and only his Social Security check as income. There are millions of Americans who denied coverage based on pre-existing conditions. One of the key things that we accomplish through health care reform is we prevent insurance companies from discriminating or excluding based on pre-existing conditions. So at the very time in Kelly's mother's life where she needed health care the most, she would have had access to an affordable option through the exchange that's being created. That would give families like Kelly's the financial security they need to plan for their retirement in a way where people can maintain their honor and their pride as families. And it's for families like Kelly's that I ask my colleagues to join me in supporting health care reform.